Hello, my name is Dr. Cheryl Burdette, and I am the clinical director for Origins Incubator. And today we talked about what do we do in a case where somebody's worked a long time with other people in the functional medicine community. They've taken them through many trials, and they're still not getting to where they need to be. And so in this case, we examined a patient, a 64-year-old female, who was experiencing pain that was diminishing quality of life. In particular, her pain would wake her up at night and she was unable to sleep through the night. And so, what we looked at were what were some of the unifying factors. And even if something had been tried in the past, really looking at dose and connection and how do we pull the whole picture together. Well, so as we unravel what is going on, the patient is having her pain is more centered in the muscles. It's more of a tension. She is also experiencing anxiety. She's experiencing insomnia. She's experiencing asthma. All of those would benefit from more magnesium. So even though she's been on magnesium, really using it at higher levels therapeutically, ramping it up to saturate her tissue was not something that had been tried yet. Relatively benign and a lot of bang for the buck. In addition to that, we noted, okay, when did that pain start? Well, it started around menopause. And as we look at her hormones, what we found was progesterone was normal, but that was because it was being treated. But testosterone and estrogen just really bottomed out. And we know joint pain, muscle pain, issues in terms of bursitis or ligaments can all be made worse in an estrogen deficient environment. And testosterone is a real go-to for managing pain. Then we thought about what could be done in terms of dietary shift, and she looked at food sensitivities and had big reactions to tomatoes. As those were taken out, her pain had improved. But looking for kind of next steps, well, it turns out there's a lot of good research and data around, for example, a ketogenic diet helping us with pain response. And so as we move into more of a ketogenic diet, we reduce oxidative stress, we reduce inflammation, we downregulate NF-kappa B. And so there are multiple clinical trials that have showed reduction in pain with a ketogenic diet. One that we looked at was one in which they started with a whole foods diet and then went from a whole foods diet to a whole foods ketogenic diet. And so a really fascinating study because there was pain reduction in both of those arms, but the ketogenic arm had much better reduction in pain, an increase in quality of life, and a number of significant outcomes in that study. In addition to that, we looked at the role of insomnia. And so it turns out melatonin has fabulous research in terms of reducing pain, fibromyalgia-like pain, but neuropathies as well. And so lots of animal data, but human data too. And so when we look at dose, not for sleep, even though she does have insomnia, when we look at that dose for pain response, now we know to change what we're doing there rather than using maybe a 2 to 5 milligram, moving that up to 10 milligrams because that's where the studies are in terms of pain reduction. Just plain old water, making sure that we up her water time and a half probably with some trace minerals to make sure we're flushing out those pain mediators. And then an interesting piece of her lab work was first, she was certainly moving in a diabetic direction. And so, or no, she was frankly. And so really looking at that role that high insulin has in pain response, and they are very tightly connected. So controlling blood sugar is controlling pain. In addition to that, notice that her lymphocytes were elevated. So considering could there be a viral element? So that filled the plate in terms of treatment of where to start. But we've already mapped out the next plans, understanding that, okay, we'll look at something, very simple to look at, like a CBC, see what's happened in terms of that viral response in the past 3 months. Has pain remained the same? If that's the case, then that helps us decide how much the viral piece is playing a role. But again, when we work in the space of of integrative medicine, so many tools. So even being able to choose antivirals like lemon balm, that also would reduce anxiety. So many ways to surround a patient in therapies that can help get them to the goal, even if they've tried things in the past. Looking back, did they try it long enough? Did they do enough of it? And did they put the picture together in a way that would help to get them ultimately to feeling better on their journey towards wellness?